When we talk about aging, the first image many people associate it with is the loss of vitality, physical limitations, and the increasing risk of chronic diseases. But there is a silent and rarely discussed reality that profoundly transforms life after 60, the burden of preventable infections. In Brazil and around the world, a simple cold can turn into severe pneumonia, a skin rash can turn into months or even years of chronic pain, and a flu that seemed harmless can be the trigger for a hospitalization that weakens the entire body. The most alarming fact is that millions of these hospitalizations could be prevented with 3 vaccines that are already available, yet little known or valued by the population over 60. These 3 vaccines form a powerful protective shield, capable of significantly reducing the complications that most fill hospital beds in this age group: the vaccine against the respiratory syncytial virus, or RSV, which remains almost invisible in public health debates, but is already showing impressive results in countries that have implemented it; the herpes Zoster vaccine, which prevents not only a painful rash, but also the terrible post-herpetic neuralgia, one of the most disabling chronic pains described in medicine; and the well-known flu vaccine, which, despite being old and free in Brazil, continues to be underestimated in its ability to save lives. The key point is that each of these vaccines acts on a different front of elderly vulnerability. The RSV vaccine protects the lungs against a silent and highly underestimated enemy. The Zoster vaccine safeguards the nervous system against a virus that never leaves the body, simply waiting for weakened immunity to attack. Meanwhile, the flu vaccine acts as both an individual and collective barrier, reducing the risk of hospitalizations, heart complications, and even deaths. Together, these 3 vaccines have the potential to drastically reduce hospital bed occupancy during critical months like autumn and winter, when respiratory viruses spread more intensely. And yet, the Brazilian reality reveals a concerning gap. While the flu vaccine is part of the public health system calendar and reaches millions of people every year, the herpes Zoster vaccine still depends on the private sector and bureaucratic incorporation processes, while the RSV vaccine has not even entered the public agenda, despite its relevance already being recognized in developed countries. This contrast between what already exists worldwide and what has not yet reached the most vulnerable population is what makes this discussion urgent. Every year of delay means thousands of unnecessary hospitalizations, shaken families, and elevated healthcare costs. Throughout this narrative, we will explore in detail how each of these vaccines works, their proven benefits, what is already available in Brazil, what is under review, and what changes we can expect in the coming years. But before diving into data and evidence, it is important that you, whether you are over 60 or care for someone in this age group, keep a simple truth in mind. 3 small shots can make the difference between living a calm winter or facing the distress of an unexpected hospitalization. Few people over 60 have ever heard of RSV, the respiratory syncytial virus. And yet, it is one of the main causes of bronchiolitis and pneumonia in children, as well as one of the greatest silent threats among the elderly. This happens because RSV aggressively attacks the respiratory system, causing severe inflammations that often require hospitalization. Until recently, there was no direct and effective way to prevent it in adults, which is why it was rarely discussed outside medical circles. The result was that thousands of elderly hospitalizations every year were attributed to respiratory complications without recognizing the true culprit. In recent years, especially in 2023 and 2024, science changed this reality with the development and approval of specific RSV vaccines aimed at the elderly. For the first time, people over 60 gained access to a preventive tool against this virus that had historically been treated as inevitable. Initial studies showed significant reductions in hospitalizations, with high effectiveness even in the so-called real world, that is, outside the controlled environment of clinical trials and already in real population use. Countries that adopted RSV vaccination for the elderly are already seeing significant declines in severe respiratory complications, relieving overwhelmed healthcare systems. The importance of this vaccine goes beyond immediate disease prevention. In the elderly, a hospitalization due to pneumonia or bronchiolitis is not just an isolated episode. It triggers a chain of consequences that include muscle loss, increased frailty, fall risks, and even cardiac complications. In other words, an RSV attack can accelerate frailty processes that permanently compromise quality of life. That is why the vaccine's impact is multiplied. It is not just about avoiding an infection, but about preserving autonomy and independence. In Brazil, the debate about the arrival of this vaccine is still in its early stages. Unlike the flu vaccine, which has been part of the national calendar for decades, and the herpes zoster vaccine, which at least entered the evaluation process of the public health system, the RSV vaccine still depends on the private sector for those who can afford it. This creates a huge barrier to access, since the most vulnerable population, low-income elderly with chronic diseases or those who depend solely on the public system, remain unprotected. However, expectations are that international pressure and increasingly consistent data on effectiveness and cost-benefit will accelerate its evaluation process by Brazilian authorities. The expression silent revolution fits perfectly here because RSV has never had the visibility of the flu or COVID-19, but it has always been there, circulating, causing respiratory crises and serious complications. The arrival of this vaccine represents not only a scientific achievement, but also an opportunity to rethink how we handle infections in the elderly. Instead of waiting for the disease to appear and rushing to treat it, we now have the chance to block the problem before it begins. It is a paradigm shift that could save thousands of lives each year, provided there is investment and adherence. Among all the diseases that threaten quality of life after 60, few are as underestimated as herpes zoster, popularly known as shingles. It is the reactivation of the chickenpox virus, varicella zoster, which remains dormant in the body after the initial infection and can return when immunity weakens, usually in old age. The first manifestation is a painful rash in the form of red blisters that spread across the skin in a localized band. But the real nightmare begins afterward. In up to 30% of cases, the elderly develop post-herpetic neuralgia, an intense chronic pain often compared to constant electric shocks, which can last for months or even years. This complication is considered one of the most disabling pains described in modern medicine, stealing sleep, appetite, and autonomy. The good news is that science has also made major advances in this field. The first herpes zoster vaccines appeared over a decade ago, but had limited effectiveness, especially in people over 70. This reduced the expected impact, since the population that needed it most was the least benefited. However, with the development of a more modern recombinant vaccine, the reality changed radically. Studies show over 90% effectiveness regardless of age, with long-lasting protection even in advanced age groups. This evolution transformed global perceptions of zoster prevention, making the vaccine a priority in many countries. In Brazil, however, the situation remains unequal. The most modern herpes zoster vaccine is available only in the private sector, with high costs ranging from hundreds to thousands of reais for the 2-dose scheme. This makes it inaccessible to most elderly who rely solely on the public system. The good news is that there is already a formal request under review by CONITEC, the commission that evaluates new technologies for the public health system. The process involves cost-effectiveness studies, impact projections, and negotiations with manufacturers, and there is hope that in the coming years, this vaccine will be incorporated into the national immunization schedule. While approval has not yet come, the reality is harsh. Brazilian elderly remain unprotected against a disease that may not kill in most cases, but can turn life into daily torment. It is essential to emphasize that herpes zoster is not just a skin rash, as many believe, but a real threat to quality of life that can isolate, depress, and weaken the elderly. Post-herpetic neuralgia does not easily respond to common painkillers and requires long, expensive treatments with antidepressants, anticonvulsants, and opioids, which often fail to bring complete relief. Prevention is, without a doubt, the only truly effective strategy. The emotional impact of this disease is so significant that in several countries, specific awareness campaigns have been created to promote vaccination. They highlight real stories of elderly people who lost nights of sleep, stopped walking, became socially isolated, and even fell into depression due to persistent pain. This is the suffering that the vaccine can prevent. Protecting against zoster does not just mean avoiding blisters on the skin, but ensuring aging with less pain, more independence, and greater dignity. In the near future, when the vaccine becomes part of the public system, It will be a crucial step toward reducing the burden of disabling diseases among Brazil's elderly population. Among all vaccines available for the elderly, none has such a consolidated history as the flu vaccine. It has been part of the Brazilian calendar for decades, offered free of charge every year by the public health system, and yet it continues to be underestimated. Many still believe that the flu is something simple, but the reality for those over 60 is very different. Influenza infection can trigger pneumonia, decompensation of chronic heart and respiratory diseases, as well as prolonged hospitalizations that further weaken the body. It is estimated that during each influenza season, thousands of elderly people are hospitalized in Brazil, and a large part of these complications could be avoided with a simple annual dose. The relevance of this vaccine becomes even greater when we think about the concept of immunosenescence, the natural process of immune system weakening with aging. The elderly body no longer responds as strongly to external threats, and for this reason, any respiratory infection tends to be more severe. The flu vaccine acts as a strategic reinforcement, training the immune system to quickly recognize the virus and prevent it from causing harm. Even in cases where a vaccinated elderly person still contracts influenza, the protection significantly reduces the risk of severe complications and the need for hospitalization, which already represents a huge gain in terms of quality of life and preservation of independence. Another essential point is the constant updating of the flu vaccine. Unlike others, which provide protection for years, influenza mutates frequently, requiring annual reformulation by the World Health Organization. This means that vaccination campaigns are not just a tradition, but a technical necessity to ensure that the elderly are protected against the most recent circulating strains. This is often ignored, but it makes all the difference. Taking the vaccine only once in life is useless because the virus changes and protection needs to be renewed every year. In addition, the flu vaccine serves as the foundation of a broader immunization schedule for the elderly. This is because it can be applied together or in short intervals with other essential vaccines, such as Zoster and RSV. In countries that already organize integrated calendars, the strategy of combining campaigns increases adherence and reduces protection gaps. In Brazil, although the flu vaccine is the most widespread, there is still resistance among part of the population who doubt its effectiveness or believe in myths that the vaccine causes the flu. It is crucial to clearly reinforce that this is not true. The flu vaccine does not cause the disease but prevents complications that can be costly in terms of health and life. Finally, there is also the collective impact of flu vaccination. When coverage is high, the virus circulates less, which protects not only the vaccinated elderly but also their families, friends, and caregivers. It is an act of individual responsibility that generates community benefits, reducing outbreaks, relieving hospitals, and freeing up healthcare resources for other demands. In the Brazilian context, where influenza continues to be one of the leading causes of elderly hospitalizations during winter, keeping this vaccine a priority means ensuring not only longevity, but years of life with more independence and less suffering. When we talk about vaccines for the elderly, it is common for each one to be discussed separately. Flu on one side, Zoster at another time, and now RSV entering the debate. But the great advancement for health after 60 lies precisely in the idea of integrating these immunizations into a single, clear, and practical calendar. After all, it is not enough to know they exist. It is necessary to organize the right time to receive them, ensure proper intervals, and understand that together they form a much stronger shield against hospitalizations. This is the concept of the ARTWI integrated calendar, a tool that helps both the elderly and healthcare professionals to see the complete picture of protection. In practice, the integrated calendar works like a map. The flu vaccine appears every year, usually between March and May, in a consolidated national campaign. The herpes zoster vaccine, in the current 2-dose recombinant version, can be scheduled at any time of the year, provided there is at least a 2-month interval between doses. The RSV vaccine, in countries that have already adopted it, has been recommended annually before winter, in a schedule similar to influenza, since the risk of virus circulation increases during colder seasons. Organizing these dates together avoids unnecessary overlaps, reduces trips to health centers, and ensures that the elderly do not miss opportunities for vaccination due to lack of planning. A noteworthy aspect is that, from a clinical perspective, there is no problem in receiving more than one vaccine in close periods, as long as the doctor evaluates the patient's health history. In many cases, vaccines can even be administered on the same day, in different parts of the body, which increases convenience and reduces the risk of forgetting. This type of strategy has already been adopted in countries with advanced elderly vaccination schedules and has shown excellent adherence results. The simpler the process, the greater the chances that people will complete their schemes and remain protected. The difference between private networks and the public health system also weighs heavily in this scenario. Today, only the flu vaccine is guaranteed free of charge for all elderly people in the public system. The herpes zoster vaccine is still limited to private clinics with high costs, and the RSV vaccine has not even entered the public options list. This disparity creates a two-tier calendar, one for those who can pay, more complete, and another for those who rely exclusively on the public system, more restricted. The expectation, however, is that the coming years will bring important changes, with the progressive incorporation of new vaccines into the public system, balancing access and enabling more elderly people to receive complete protection. When we analyze the expected impact of an integrated calendar with these three vaccines, the numbers are clear. International studies show significant drops in hospitalizations due to pneumonia, bronchiolitis, severe influenza, and post-herpetic neuralgia. Translating this to the Brazilian reality, where the public health system faces constant overload, this would mean not only more health for the elderly, but also financial relief for the system, which spends billions every year on preventable hospitalizations. The calculation is simple. Each dose applied may represent one less occupied hospital bed, one elderly person preserving their independence, and one family avoiding suffering. That is why the integrated calendar should not be seen as a luxury or technical detail, but as a practical life tool. Imagine a paper printed and fixed on the refrigerator, with the vaccine dates clearly marked, serving as a daily reminder and visual guide. This organization transforms knowledge into action and helps create a culture of prevention that goes beyond medical appointments. After all, aging with health depends not only on medications, but on preventive strategies well applied at the right time. The major issue involving elderly vaccination in Brazil today is not only scientific, but also political and economic. While in European and North American countries, there is already talk of national RSV vaccination campaigns and universal access to the most modern herpes zoster vaccines, here we still live with inequality of access. The public health system provides the flu vaccine every year in an exemplary way, but the incorporation of new immunizations goes through long and complex processes involving cost-effectiveness evaluations, price negotiations with the industry, and priority definitions within limited budgets. This raises the question, what is coming in the public health system when we talk about vaccines after 60? The first concrete movement is related to herpes zoster. As already mentioned, there is a formal request under review by CONITEC, the commission responsible for evaluating new health technologies. This process is not just bureaucratic, it requires detailed studies on how much the vaccine can save the system in the medium and long term. Since, although the initial cost is high, preventing post-herpetic neuralgia and related hospitalizations can widely compensate the investment. Specialists consider that the inclusion of this vaccine in the national calendar is only a matter of time, especially since it has already become standard in several countries. The RSV situation is more delicate. Despite robust international evidence, the vaccine has not yet entered formal evaluations in Brazil. The main reason is the high cost, since it is a very recent technology. However, the pressure for this debate to move forward grows each year, especially because respiratory infections in the elderly continue to overload hospitals. A possible incorporation may begin in a restricted way, prioritizing high-risk groups such as elderly people with chronic diseases or those living in long-term care institutions. This gradual strategy has already been used with other vaccines in the past and may be a way to make access viable. Another relevant point is that vaccination policy in the public system does not depend solely on CONITEC, but also on decisions by the Ministry of Health and international negotiations to reduce prices. Often, a vaccine only enters the Brazilian calendar when there are agreements for local production or technology transfer, which lowers costs and ensures long-term sustainability. This scenario may apply to both the Zoster and RSV vaccines, making public institutions like Fiocruz and Butantan key players in the process. From a practical perspective, the next 2 to 5 years will be decisive. Most likely, we will first see the incorporation of the herpes zoster vaccine, given the maturity of the studies and its already recognized priority in technical reports. RSV may take a little longer, but it is unlikely to stay off the radar, since Brazil's aging population and increasing life expectancy make expanding protection against severe respiratory diseases urgent. Meanwhile, the flu vaccine will remain the foundation, with national campaigns increasingly integrated into other prevention strategies. The future of vaccination in the public system, therefore, points to a more complete and structured elderly calendar, but one that will depend on political decisions, economic agreements, and social pressure to advance. Each step in this direction represents not only a scientific achievement, but a real gain in dignity for millions of Brazilians who grow old without full access to technologies that already exist in the world. Information without action does not bring transformation. That is why, after learning about the vaccines that can change aging, RSV, herpes zoster, and flu, the most important step is to turn that knowledge into practical questions to bring to the next medical appointment. This checklist works as a simple but extremely effective guide to help the elderly or their caregiver leave the consultation without unanswered doubts. It also serves as a tool of empowerment, since many patients often do not know exactly what to ask and end up accepting vague answers. Having this script in hand means leading the conversation objectively and ensuring that the best decisions are made together with the healthcare professional. The first essential question is, am I indicated for the herpes zoster vaccine? This opens the space to discuss individual risk factors, such as age, history of chronic diseases, use of medications that weaken immunity, and of course, the availability of the vaccine in the patient's healthcare network. This question is especially relevant because the vaccine is not yet included in the public system, and knowing if there is an indication helps plan, even financially, how to seek this protection. The second question is, when and how should I take the flu vaccine this year? Even though it is offered every year, many elderly people still do not fully understand the importance of getting vaccinated within the campaign period and end up postponing it. Asking directly helps reinforce the priority, clarify if there are any specific conditions that require care at the time of application, and also align it with other vaccines the patient may need. The third question is there any recommendation for the RSV vaccine in my case? Even if it is not yet available through the public system, updated doctors can inform whether it is already accessible in the private network and if there are priority groups that may benefit more from the protection. Moreover, this question also shows the doctor that the patient is attentive to new developments and willing to invest in prevention. The fourth practical question is, can I take more than one vaccine in the same period? This is a common doubt that often prevents elderly people from getting vaccinated out of fear of overloading the body. The medical answer will clarify that in most cases, it is indeed possible to take more than one vaccine, as long as certain specific recommendations are followed. This type of clarification avoids unnecessary delays and reduces the risk of forgetting an important vaccine. Finally, the fifth indispensable question is, how can I track my vaccination calendar going forward? This helps create a long-term plan, not just for that specific moment. Doctors and healthcare teams may recommend apps, updated physical vaccination cards, or even printed calendars placed in visible spots at home, such as the refrigerator door. This organization turns prevention into a habit rather than an isolated action. With this simple checklist, the elderly person takes control of their own health and ceases to be a passive spectator, becoming the protagonist of the decisions that ensure better quality of life. The doctor becomes a partner in a structured plan, not just someone who reacts to problems already in place. This change in attitude is one of the greatest indirect benefits of awareness campaigns, creating a culture of active and constant prevention. At the end of this journey, what emerges is a simple but powerful truth. 3 vaccines can completely transform life after 60. The RSV vaccine, still little known, protects the lungs against an invisible enemy that has already caused thousands of silent hospitalizations. The herpes zoster vaccine, modern and highly effective, offers the chance to avoid chronic pain capable of stealing years of quality of life. And the flu vaccine, old but indispensable, remains the solid foundation of a protective calendar that saves lives every year. Together, they represent not just disease prevention, but the opportunity to preserve the autonomy, independence, and dignity every elderly person deserves in their journey. The key message is that aging with health is not the result of chance, but of preventive choices made at the right time. Often, a simple decision to get vaccinated is enough to avoid a long hospitalization, a painful treatment, or even an irreparable loss. That is why doctors and specialists insist every vaccine taken is one less risk, one more barrier against the frailties the body faces with age. It is not a luxury, but a basic necessity to ensure that the years gained through longevity are lived with vitality. More than information, action is needed. The invitation is clear. Talk to your doctor, ask specific questions, inquire about the availability of each vaccine, and organize your schedule. If possible, keep a printed material at home, fixed to the refrigerator, to avoid forgetting important dates. Turning this knowledge into routine is the most concrete step you can take today to protect your future and the future of those you love. We close with a reflection. 3 quick shots can mean fewer months of pain, fewer weeks in the hospital, more days of autonomy, and above all, more years of life with dignity. Do not underestimate this power. Getting vaccinated after 60 is not just a medical measure. It is an act of self-care, of self-love, and of responsibility toward everyone who walks beside you.